What if I told you that a sugar pill could cure your pain, ease depression, and even help people with Parkinson's disease, all without a single active ingredient? Sounds impossible, right? But it's real. In clinical trials all over the world, patients have reported relief from symptoms after taking nothing more than a fake pill, a saline injection, or even undergoing a sham surgery where doctors only make an incision and then close it back up. No drug, no real procedure, and yet, real results. Imagine this. Two patients, both suffering from chronic pain. One receives morphine, the other gets a pill made of nothing but sugar. Yet both of them feel their pain fade away. Their brains react as if they had actually taken powerful medication. This isn't magic. It isn't delusion. It's something scientists call the placebo effect. And it is one of the strangest, most mysterious forces in medicine. The placebo effect reveals something almost unbelievable. That belief alone can change our biology, that the brain can convince the body to heal, to fight, to perform, sometimes nearly as powerfully as real drugs. And here's where it gets even stranger. Placebos don't just work on small things like headaches. They've been shown to improve depression, reduce anxiety, calm symptoms of irritable bowel syndrome, and even trigger the release of dopamine in patients with Parkinson's disease. How can something fake act so real? That's the puzzle scientists have been chasing for decades. And the deeper we dig into this phenomenon, the stranger it becomes. This is the strange science of placebo. And once you understand it, you'll never think about medicine or your own mind the same way again. The story of the placebo effect begins centuries ago, long before modern medicine had pills, injections, or MRI machines. The word placebo comes from Latin, meaning "I shall please." Originally, doctors used it to describe treatments given more to make patients feel cared for than to actually heal them. Early physicians noticed something curious. Patients often improved even when they were given treatments that should have done nothing at all. A herbal tonic, a sugar pill, or a simple ritual. Sometimes these worked as well as real medicine. For years, this was dismissed as coincidence or wishful thinking. But in the 20th century, researchers began to study it scientifically. They created the first controlled trials, giving one group the real medicine and another group a fake version, a placebo. The results were shocking. Time and time again, patients taking the placebo reported real improvements in pain, mood, and even physical function. In some cases, the differences between the placebo group and the real treatment group were small, but in others they were astonishingly close. The mystery wasn't just that placebos worked, it was why they worked. How could a sugar pill or a fake procedure produce actual changes in the body? How could the mind influence healing in ways that were once thought impossible? This question has driven decades of research. Scientists began to realize that the placebo effect wasn't just a trick. It was a window into the mind-body connection, a sign that our expectations, beliefs, and perceptions could literally alter our biology. And it's not just a curiosity from the past. Today, understanding placebo is changing the way doctors think about treatment, revealing that medicine isn't just about chemicals and surgery, it's also about the incredible power of the human mind. The real question now is, how does it do it? That's what we'll explore in this video. So how does a sugar pill or a fake procedure actually trick the brain into healing the body? The answer lies deep inside our nervous system, in the chemicals and circuits that control pain, pleasure, and expectation. When a person believes that a treatment will help, the brain doesn't just sit there, it reacts. It releases endorphins, the body's natural painkillers, and dopamine, the chemical of reward and motivation. These are the very same substances triggered by real medication. In other words, the brain can fool the body into thinking it has received powerful medicine, even when it hasn't. Brain scans reveal something even more fascinating. Regions like the prefrontal cortex, responsible for decision-making and expectation, and the amygdala, the center of emotion, light up in response to placebos. The brain is essentially saying, "I believe this will help," and then physically creating the effects of that belief. This phenomenon isn't limited to pills. In studies of sham surgeries, procedures where doctors go through all the motions of an operation without actually performing it, Patients often report real relief. Their symptoms improve, their mobility increases, and their pain diminishes. The mind, expecting healing, triggers biological responses that mimic the effects of actual surgery. Even more mind-bending, the strength of the placebo effect often depends on the context. A brightly colored pill can feel more effective than a dull one. Injections seem more powerful than pills. The authority of the doctor, the rituals of treatment, even the environment of the clinic, these all amplify the effect. The brain is not just passive, it is interpreting signals, expectations, and beliefs, and then responding in kind. The placebo effect shows us that healing is not just chemical or mechanical. It is psychological, neurological, and profoundly human. What the brain expects, the body can often deliver. The power of the placebo doesn't stop in the doctor's office. It stretches far beyond medicine, reaching into sports, performance, and even our daily habits. Take athletes, for example. In studies, runners and weightlifters often perform better when they believe they've taken a performance-enhancing substance, even if it's just a sugar pill. Their brains trigger energy, focus, and endurance as if they had actually received a boost. The expectation alone can push the body to achieve more than it thought possible. Placebos also work in mental health. Patients with depression or anxiety sometimes improve simply by believing they're taking antidepressants, even when the pills are fake. The mind's anticipation of relief activates the same brain regions targeted by real medications, releasing neurotransmitters that improve mood and reduce stress. Even everyday rituals tap into this effect. Lucky charms, morning routines, or superstitious habits may feel trivial, but they can boost confidence, focus, and performance. The brain interprets these cues as a signal that success is possible, and the body responds. Here's the truly astonishing part. Even when people are told they're taking a placebo, it can still work. Known as open-label placebos, these treatments show that belief doesn't always require deception. Simply participating in the ritual of care, paying attention to your body, and expecting improvement can trigger measurable changes. The placebo effect is everywhere. It isn't just a quirk of medicine, it's a window into the mind's remarkable ability to influence the body. Expectations, rituals, and belief can shape not just perception, but reality itself. The placebo effect is incredible, but it also raises a difficult question. Is it ethical to use it? After all, much of the traditional placebo effect depends on deception. Patients often improve because they believe they are receiving real medicine, even when they are not. But is it right to trick someone, even if it helps them feel better? This dilemma has puzzled doctors and ethicists for decades. On one hand, the placebo can relieve pain, improve mood, and even enhance recovery from serious conditions. On the other hand, it relies on lying, which can damage trust between patient and physician. Trust, after all, is one of the most critical components of effective medical care. In response, researchers have explored a fascinating alternative: open-label placebos. These are treatments where patients are explicitly told they are receiving a placebo, yet studies show that many still experience real benefits. It appears that simply participating in a structured treatment, paying attention to the body, and engaging the mind can trigger healing responses, even without deception. The ethical questions go deeper. Could the placebo be used deliberately as a treatment tool? Could doctors prescribe it alongside real medication to enhance effects, or even replace some drugs entirely? Some argue that if the brain can harness its own healing power, using placebo intentionally is not trickery, it's science. Others remain cautious. There's still much we don't understand about why some people respond and others don't. Could over-reliance on placebos lead to neglecting more effective treatments? Could it backfire if patients lose trust in medical care? The placebo effect sits at the intersection of medicine, psychology, and philosophy. It challenges our ideas of what treatment really is and forces us to ask, is medicine only about drugs and surgery, or is it also about the remarkable power of the human mind to heal itself? The future of the placebo effect is as fascinating as its past. Scientists are now exploring ways to harness this mysterious power intentionally, not just as a curiosity, but as a real tool in medicine. Imagine a world where your mind becomes part of the treatment, amplifying the effects of drugs or even replacing them in some cases. Researchers are studying the idea of a placebo personality, why some people respond more strongly to placebos than others. Genetics, brain structure, past experiences, and even personality traits seem to play a role. Understanding this could allow doctors to personalize treatments using placebos strategically to maximize healing while minimizing side effects. In pain management, mental health, and chronic illness, placebos could reduce the need for high doses of medication, cutting risks of addiction or harmful side effects. Already, clinical trials are experimenting with combining real medicine with open-label placebos to enhance outcomes. The implications go beyond medicine. If our expectations can shape physical performance, mood, and even recovery from illness, then the line between mind and body becomes blurry. The placebo effect challenges the idea that medicine is only about chemicals and surgery. It suggests that belief, attention, and expectation are powerful forces in their own right. Some scientists speculate that in the future, prescribing placebos could become a standard practice. Carefully designed interventions that leverage the brain's own healing mechanisms. It may seem strange now, even controversial, but history shows that what once seemed impossible in medicine often becomes commonplace. The placebo effect is no longer just a trick. It's a glimpse into the untapped potential of the human mind. And the more we study it, the more we realize that the mind may be the most powerful medicine we have. If you enjoyed this video, please don't forget to subscribe. And if you want curious questions answered, have a look at some of our other videos.